So today we performed a procedure on Jakobi, our oldest male giraffe. The procedure today involved a multitude of things. The most important was dental assessments.
So we've been doing voluntary radiographs of his jaws over the years. So we were able to see that he had some wear on some of his teeth. So that was something we wanted to look into deeper, and that's really hard and challenging to do voluntarily. So we knew at some point we would want to do a sedation on him.
We had two specialists from Iowa State, Dr. Joan Howard and Dr. Brenda Mulherin. So brought them in specifically to evaluate his teeth and make some assessments. We had a crew from Omaha Henry Doorly Zoo that came over here to help us with anesthesia itself. They have a more robust history of being able to manage giraffe anesthesias, so that was very beneficial to have them here as well.
So my specific role in this was to help examine the oral cavity of the giraffe, Jakobi, as well as to biopsy an oral mass that was present on the left side of his face that was associated with the lips. And when we incised into the mass, there was a little bit of fluid that came out of it that gave us at least a suspicion that it could be something that was a little bit infectious or bacterial component. So we collected some samples of the fluid for culture and sensitivity to see if an antibiotic would help. We also collected a sample of the solid portion of the mass to be able to send that to a pathologist to be able to try to tell us what exactly the mass is made of. Our suspicion is that it is likely some sort of foreign material that may have kind of migrated its way into that cheek tissue, which then in turn walled it off, so it's kind of a very firm walled off abscess is what our suspicion is.
We met some challenges in looking at the giraffe's mouth. The giraffe has a very long mouth. I usually work on horses, not quite so long, so it was difficult to visualize as well as we would hope we would. And he also was intubated, so you had an endotracheal tube they had to work around. But we were able to, brought a small plumber's camera that we could use to visualize the teeth. And also we were able to do like a manual examination. And what was good is there were some expected changes there, that he's older and has some wear on his teeth, and they're not as, doesn't have the rough surface he used to when he was younger, I'm sure. But overall, the teeth looks pretty healthy, just had lost a lot of their enamel, so he's not be able to chew as well as he used to. So.
We are fortunate enough to have Valerie Johnson present from Michigan State, who did some stem cell therapy as well today.
So we were anesthetizing a male giraffe today who is getting older, and with that comes age-related osteoarthritis. My research involves giving adult-derived stem cells to animals with osteoarthritis, and what it does is it decreases the inflammation, so that helps with pain relief. But in addition, it also stimulates other cells that are in the area to become active and actually start to repair damaged joint tissue. And so we did a technique that we call regional perfusion, where we inject some of the stem cells in the leg where the joint disease is, and we put a tourniquet around the leg for a brief period of time to help the cells actually migrate out of the blood vessels into the tissue where they're needed. So we did that on both of the front legs, and then we gave a more concentrated stem cell solution in the central vein so that it could go to wherever it wants to in the body. And these cells track to areas of inflammation. So if there's inflammation in other joints that we don't know about, the stem cells will know about it, and they will go to those areas and help to decrease the inflammation. So hopefully Jakobi will start to walk more comfortably. He also had some foot trims done, which will help with that as well. And what we're hoping is that his mobility will be increased with the stem cell injections, and that he'll start to feel a little better. So, maybe he'll walk a little faster or a little more smoothly. We usually expect that within about a month, they'll start to get more comfortable and be able to walk a little bit better.
So I think overall the procedure went really well. Everything from anesthesia, so Jakobi going down safely, being maintained in an anesthetic plane while all these procedures were occurring, to even standing up went really well. And obviously with any large animal like a giraffe, there is a variety of things that can occur that we can't control. And so we were very fortunate enough today that we planned and provided mitigation strategies for those risks. And ultimately, he helped us a lot by going down very well, very smooth, was not significantly problematic during the procedure, and then recovered really well and also really smooth. So the big two hurdles are the beginning and the end. And fortunately, he did and managed those very, very well. I hope, because we took this opportunity today, that we allow him to have a better health outcome for the remainder of the years he has. So fixing his teeth now provide better dental health for the next 5, 6, 7, 8 years. Same thing with his joints. There's no easy fix for old age arthritis, and so it's how can we continue to manage it as he continues to get older. And so I think this is just a step in the right direction, and it's all obviously not going to end here. We will continue to manage him as he gets older, but I think this is, again, a good step in the direction for providing good quality health care and not being afraid of an older giraffe, which notoriously comes with challenges, and to not just give up because it's hard, right? So it's putting things in place to make yourself self-successful, but also making health successful for these animals we care for. I just want to thank all of Blank Park Zoo staff. It takes a village to be able to perform a procedure like this. All of those people were a key in the success for Jakobi's procedure today.